Okay, here we go. This is upper extremity week five upper extremity lecture. And today, this week, which this is the last week before the midterm, going to be tackling hemiplegia, in particular subluxation of the shoulder with hemiplegia from a stroke, and then these basic elbow repetitive motion kind of injuries, tennis elbow, radial tunnel syndrome, and golfer's elbow. Okay, so let's kind of do some review first. How to do it, how does it test, what does it test for, where would you palpate, how would you treat it? Always remember to palpate, follow your thumbs after you do the test, very important. Okay, so we did the RUSE test. RUSE, I think it's called the EAST test as well. What is that for? Thoracic outlet. Where would you palpate? You do Tinel's tapping along the thoracic outlet of the brachial plexus coming out of your neck, out of the scalenes, under that first rib, under your collarbone, and down through the pec minor. That's where you palpate. How would you treat it? Pec minor stretch. Pec minor stretch is a great treatment for TOS. Speeds test, what is that for? Should know this. Bicep tendonitis, where you're going to palpate. You're going to palpate on the bicipital groove in front of the anterior shoulder. How would you treat that? Posture, rows, limiting overhead motions. It's very kind of gentle overhead motion seem to get it going. What's going to distinguish it as bicep tendonitis is the palpation in the test. Gerber liftoff test. What is this for? This is for subscapularis internal rotation, where you're going to palpate the subscapularis under the armpit. How would you treat that? A good stretch. The subscap is external rotation, going the opposite way. Empty Foucan test. How do you do that one? You put your shoulder into scaption, your thumb up, pretend like you're emptying a can of soda or something. Apply some resistance. That is for the supraspinatus test of the rotator cuff. Where would you palpate? I would palpate probably the subscap under the top of the spine of the scapula. How could you treat that? A good way to treat that is shoulder extension. Open up some space in there. Infraspinatus. That's the infraspinatus test. It's manual muscle testing of the infraspinatus. Going to palpate the back of the shoulder blade where the infraspinatus is. How could you treat that one? If they have soreness with external rotation, you could try stretching them into internal rotation. Adhesive capsulitis. There is no test for adhesive capsulitis, but there's some classic signs of it. Shoulder pain with no history of trauma, no history of work-related injuries. Passive range of motion and active range of motion are about the same. There's no loss of strength. Generally speaking, there's really no loss of strength with adhesive capsulitis. They're just losing that range of motion, and it goes in that progression over 3 to 6 months, different stages of freezing up. Sperling's compression test. What is that for? That's for cervical compromise in their cervical bones of the neck, damage the cervical bones of the neck, impingement, pincing or impingement of the nerves coming out of the neck. How do you do that? Sitting, good posture, just pushing down on the head. Good treatment for that. If that causes irritation or pain, and it's nothing serious, the MRIs are negative, no history of recent trauma, cervical traction. Cervical traction is a great treatment if it's positive for Sperling's compression. Okay, these are our learning objectives we're going to be tackling today, getting into all these different diagnoses. And here's our case for the day. Let's see if we can help her out. This is a client, her name is Cinderella. She's 26, and she has right elbow pain down in here, Focal to the lateral epicondyle. After spending the week scrubbing floors, here's the scrubbing, and carrying buckets of water. To make extra cash, she also works weekends as a carpenter, doing a lot of hammering. Think of that motion, hammering. She presents us with weakness and range of motion deficits with wrist extension and pronation. She says the pain is now so bad it even hurts. 2 out of 10 to lift a cup of coffee. She said the pain came on gradually over the last 6 months, and before that she was pain-free and had no significant medical history. Her goal is to recover enough to make a new dress for the ball which she secretly hopes to attend. What is wrong with her elbow? How can we treat it? Will she have to spend the rest of her life in pain scrubbing floors?